DataWalk is a multi-user software platform used by government organizations to combat coronavirus by identifying individuals breaking quarantine, predicting areas of outbreaks, optimally allocating precious medical resources, and identifying gatherings in high-risk zones. In this demo, I'll show how DataWalk can also enable health agencies to assign scores to populations to determine priorities for vaccinations and to ensure an efficient distribution system. In DataWalk, you can easily connect many disparate types of data. Here we have data sources used for the first and second waves of COVID, such as mobile device data logs, medical records of infected and quarantined people, locations of medical clinics and hospitals, and their available resources, such as personnel and ventilators. This is supplemented with infection statistics imported from official government websites. To be able to score a population efficiently, we ingested CDC reports on infection effects for various demographic groups, including mortality rates and percent admitted to hospital. We've also included data about employment and public health data to identify the locations of priority populations. We can also include data regarding distribution in medical facilities that will be required for ensuring continuous, seamless vaccine distribution. There are a variety of strategies for scoring that are closely aligned with available data, outbreaks, social consent, and local conditions and resources. In this example, we'll simulate two of these. For the first example, we'll present two scores that prioritize population groups and locations for vaccination. We assume that local authorities have data for healthcare personnel and uniformed professionals such as law enforcement and firefighters. For this group, we can generate a separate score that will automatically assign three categories, A, B, and C, where A has the highest priority and C the lowest. To do this, we combine and weight rules that were easily configured in DataWalk, for example, type of occupation from the National Standard Classification, age groups, and the risks based on reports provided by the CDC. The results are available here under this big button. The list contains the score value, with the category assigned automatically based on various thresholds. It also includes personnel data, category, the particular location, and medical facility assigned. The list can be automatically redistributed between assigned medical facilities or local authorities for further usage to vaccinate people who are fighting on the front line of the COVID battlefield. The second score is intended for the rest of the local population, which could show areas with high proportions of healthcare workers, clinically vulnerable people, and elderly people, combined with predictions regarding the spread of coronavirus, data regarding population migration, number of active cases, and number of people quarantined. The results are available as a list of regions or locations with a numeric score, categorized from P1 to P4, and an estimate of vaccine required for the local population. For this score, no personally identifiable information is used. The final result contains a score value, assigned category, and population size considering age, occupation, and chronic diseases. These results can be used for vaccine supply planning and monitoring, which will be our third example here. To simulate the process of monitoring supply, we use fictitious data for vaccine supply, coupled with data showing the vaccination capacity of local medical facilities. We generated an analysis that shows the areas where there is insufficient capacity in local medical facilities relative to the number of people who should be vaccinated in the first month. We see that in some cases the difference is greater than 80%. Without these gaps being eliminated, this could cost many lives, but by having this data in advance, local agencies can work to get appropriate infrastructure in place, including temporary facilities. In addition, to monitor the process on a daily basis, we generate alerts that are triggered when the plan is not consistent with demand. Any identified anomalies are visualized on a map and can be seamlessly propagated manually or automatically outside of the DataWalk system. To learn more about other COVID applications, contact us through our website at datawalk.com.